Welcome back to Healthy Living. We're back with our guest, Tiffany Raiford. She is our Director of Imaging Services at St. Tammany Health System. So Tiffany, thank you for being here with us.
Thanks for having me. Good morning.
Good morning. Tell people a little bit about you and your role at St. Tammany Health System.
Yeah, so I started off at St. Tammany in 1997 as an X-ray student. I was only 5 years old. I was a very smart kid. So much like Jonah, I've watched it, grow dramatically throughout the years. I did X-ray, CAT scan, and MRI, then went into management, and now director.
Oh, well, that's exciting, and it's a lot. We have a lot of imaging capabilities now,
Yes.
which is wonderful for our community.
When I started off, we had an old single-phase X-ray machine, and it was, something from the Stone Age, and I've watched the equipment evolve dramatically.
The technology is amazing.
Yes.
We're going to talk a little bit about that. So October, as we mentioned in the beginning, is Breast Cancer Awareness Month. And we do a lot of things to educate, screen, prevent. We like that mantra, educate, screen, prevent, because it's very important. Education about early detection and screening leads to prevention. So how does imaging fit into that educate, screen, prevent mantra?
Well, very, very important component. So our board and administration focuses heavily on early detection, as well as the need for advanced technology. So they don't shy away from getting us whatever we need with the latest and greatest, advanced techniques. So we have a comprehensive breast cancer screening program as well as a lung cancer screening program. So, we have the Be Well bus, which provides mammography out in the community, and we have our Mandeville location with mammography and bone density, and then our Women's Pavilion.
And let's talk about the Be Well bus, mammography out in the community. It may sound to some like, oh, well, is that the same quality of imaging that I would necessarily get if I went in and had my mammogram within a building?
Right.
Speak to that, please, because we just talked about this recently.
Yes. So we are standardized. We have all the same equipment at our Mandeville, Women's Pavilion, and the Be Well bus. So it's all the same equipment, state-of-the-art 3D mammography.
And you and I both mentioned the Women's Pavilion. The Women's Pavilion is off of 190 in the Covington area. And then directly adjacent to the Women's Pavilion is the High Risk Breast Clinic.
Yes.
So let's take each one of those. The Women's Pavilion. When you walk into the Women's Pavilion, what are the services you can expect? And kind of how would I even go to the Women's Pavilion as a woman?
So the Women's Pavilion is a breast imaging center of excellence, and what that means is we're recognized by the American College of Radiology. So we have to follow pretty strict guidelines and requirements to meet that. It's a very prestigious award. It's pretty hefty. We have mammography, ultrasound, as well as MRI there. We just added MRI July of last year. So all three modalities offer biopsy capability, and we have certified breast fellowship trained radiologists.
Okay.
That read. That's all they do is read the breast.
So as a patient, do I have a choice basically? If my doctor says, okay, you need a mammogram, or it's it's time for your yearly mammogram, or you need a diagnostic mammogram because of whatever suspicion the doctor may have, what do I as a patient say to that provider?
You can choose where you want to go.
Okay.
So you can choose where you want to go for your screening, and you can choose where you want to go for your diagnostic. So if you have your screening somewhere else and you get abnormal results, you can certainly go to the Women's Pavilion for anything after that.
Okay.
The Women's Pavilion works very closely with the high-risk clinic, and so if there's any abnormal findings on a screening mammography, our breast care nurse contacts every patient with an abnormal finding, and they will get them in for additional testing, diagnostic mammogram, ultrasound, even an MRI if needed, perhaps do a biopsy, and then recommend to their breast surgeon with the high-risk clinic.
So the high-risk clinic, let's go ahead and talk about that since we're kind of on the topic. Why would someone, we kind of talked about why they would seek out care. What are the services, kind of in a nutshell, that are offered?
So if perhaps you do have an abnormal finding on your screening mammography and you go through the channels of finding something that's worrisome,
right.
They would refer you to Dr. Bonagera, breast surgeon, and the nurse practitioners. But aside from abnormal findings, if you have dense breast tissue or strong family history of anything else that would put you at risk for breast cancer, they also see those high-risk patients.
Okay, so that is something,
for them,
and they can kind of evaluate your situation and keep an eye on it through the years.
Yeah.
It's a relationship. That's nice. So we did talk about after some screenings, there may or may not be a finding. So we just, this year, we acquired what's called the Stereotactic breast biopsy table. And this was very, very significant for the Women's Pavilion.
Yes.
Can you tell people why? Why is this significant?
So this piece of equipment, we had an older stereotactic breast. And what a stereotactic breast biopsy table means is, so you're laying kind of on your stomach, and the breasts are kind of through some holes down in the table.
Right.
And the new table we got increased efficiency, accuracy, and timeliness. So the patient's not laying there as long. It's a lot more comfortable. You don't see a needle kind of coming at you.
Right.
You're just kind of like on a massage table.
Right.
And all the work is done from underneath. And it's phenomenal. The accuracy and the timeliness, I mean, it shortened the time by half, and the patients we've gotten a lot of good feedback.
So I know that before, with the table used previously, the tissue sample is taken, and you have to make sure that you got the right tissue sample, and it would go into another place,
Right,
and
right,
get looked at.
right.
I'm not clinical,
Right.
so. But with this table, it's real time.
Yes.
Everything happens in real time.
Yes. So with the other table, they would take a sample of the breast tissue, actually put it in sort of like a petri dish, and X-ray it on a different machine, just to make sure they got what they needed.
Right.
This one actually kind of goes through a little vacuum and simultaneously takes pictures in the tube. So there's no need for that time waiting to go take the X-ray of the tissue sample or anything like that.
So the patient is sitting in that position way less time. The provider is working on each patient way less time. So not only is it less stressful for the patient, it's more, like you said, more efficient for you, and you can see more patients that way. The wait time is less, which is great. So we talked about how we get into the high-risk breast clinic, how we get into the Women's Pavilion, the things we need to do. Is there, what are some other things you want to add about diagnostic imaging services that we provide?
So I think
Or imaging services in general?
Yeah, so I think going back to the way our board and administration supports our imaging, we just installed a new MRI at the outpatient pavilion. The time to do those MRIs is going to be cut in half. I mean, they really don't shy away from anything we need to make the best care for the patient, comfort for the patient, satisfaction for the patient, without taking away from quality and quantity. So, we're really working on access, to shorten that access to where patients don't have to wait long for an appointment. We've been successful in that this year. We've kind of gotten our days down fairly quickly. If you get a screening mammography that's abnormal, we can usually get you in within 2 to 3 days, or
Very
even maybe a day.
To peace of mind.
Yes, yes. So, they're very supportive on our needs and the care for the patient.
Now, October is Breast Cancer Awareness Month. We encourage all women to get their yearly mammogram if they meet the criteria to do that, or if they're at high risk.
Yes.
So they can do that either in the Be Well bus, they can do it at the high risk clinic. Is there any other place under your purview that they can do that?
No, with the Be Well bus, the Mandeville Diagnostic Center on St. Anne, and then the Women's Pavilion.
Okay.
We are running our $99 special through October.
Wonderful.
So, and we have truly so many success stories from early detection. I mean, it really is extremely important to get your screenings done, find that abnormality soon enough so it can be treated and you don't have to worry about it. So.
Okay. Well, is there anything else you'd like to add before we wrap up?
We are having, along with our United in Pink campaign, we'll be all over the place, everywhere.
Right.
We have several events throughout the year, screening events, so check out our website. We have a multitude of screenings, carotid screenings, bone density screenings that we do throughout the year. But we are having our Ladies' Night at the Covington Beer Garden next Friday, October 6th at 5.
Okay, wonderful.
Just wanted to throw that in
Yeah,
there.
and that's a free event. It's open to the public. Lots of things for women there.
Yes, and we will have some of our screenings. We'll have our Be Well bus there, and we'll have some bone density screenings and some other things there.
Okay, wonderful. Well, thank you so much, Tiffany, for being
for
with
having
us.
me.
I appreciate it. Everything Tiffany and I talked about as far as the St. Tammany United in Pink events and screening locations, you can find at sttammanyunited.org. So stay tuned. We'll be right back with our major gift specialist, Kathleen Thomas.